Are you a field application scientist or soon to be field application scientist who's looking to go into the clinical medical industry in this role? If so, then I have a couple of things that I want you to expect. Hi guys, thanks for tuning into my channel, The Professional PhD. I am Dr. Viola Lanier, and I'm bringing you a video today in regards to what to expect if you're a field application scientist in the medical/clinical industry. So that's what I do now. I work in the clinical medical industry, but I didn't start that way. I started out as a biomedical scientist who worked in the preclinical industry, the scientific industry, I call it. And so that training was exceptional. Well, it was awesome. It actually helped me to get my role in the medical/clinical industry as a field application scientist, then on to subject matter expert, and then on and on and on. I want to bring this video to you because sometimes we may assume that all field application scientists roles are created responsibly as far as task-wise equal. And that's not the case. I learned that in my roles that is definitely not the case. So I'm going to give you some expectations that you should have if you are trying to get into the medical industry as a field application scientist and or just got in. I have 10 things that you should expect if you are new to the field application scientist medical industry role and or attempting to get into the medical industry as a field application scientist. Now, I learned these things through experience. I didn't expect them. And so I'm bringing you this video so you know what to expect. And so you're not so surprised or so you can prepare better than I did. So let's jump right in. One of the first things you should expect is that you will not only be training physicians sometime, you will also train other medical specialists. Now, in my current role, I have the responsibility to predominantly train physicians. However, I'm in interventional radiology/radiation oncology, and so there are medical physicists that are experts within this realm as well. And so my expectation is to have to train them. And so I'm training them. I'm also training other people who may be a radiation oncologist, nurse. These are other people that work well or work closely with the interventional radiologist or radiation oncologist. I felt like I just said a lot, but point blank, just know you will not only be training the physicians, you will also train other medical experts as well. The second thing you should expect is that your training days will look totally different. Listen, in the preclinical world, the scientific industry world, I had these long days where I would know that my training would start at 9 and it would end at 4 or 5. And in the medical industry, it just hardly ever operates that way. And so I'll have a training day plan, but when I get there, the physicians are super duper busy, right? Between actual cases and patient support. And so what I've planned or how I used to plan, it cannot be the same way. I cannot think that I have all of this time, even a whole hour could be asking for a lot. And so your training days will be structured differently. You may have content, right, that is worth 2 hours worth of content that needs to be taught to them. However, you're going to have to figure out how can you get that 2 hours of content reduced? How can you make sure, even if it can't be reduced, then how can you make sure that it is delivered according to their availability during that day? Your training days will look different. The third thing you should expect is that you're going to have to get in where you can fit in when it comes to training. And that is because the physician schedule is busy and can involve a lot of changes. And it's not necessarily because of them, but it's because of the patients. It depends on if the patient maybe comes in on time, or if maybe the operating room is set up on time, or it can be all sorts of things. And so these are the things that I had to learn to expect, is that, you know what, I get in where I can fit in. Sometimes I'm literally sitting in a clinical room and I'm watching through a glass window someone get surgery, and then after that point I can actually get my training time in where it fits in with the doc, and he may have 20 minutes or he may have 29 minutes. The fourth thing you should expect is that you more than likely may have to split up your training content. And so I mentioned this briefly a little bit earlier, but this is very important. When you devise or develop your training lesson, then you need to figure out how you're going to make incremental deliveries of this lesson. And sometimes what you think the order that it should be in is the best fit for that doctor, and a lot of times it may not be. So you have to be very quick in knowing how to redirect or reorganize the delivery of that lesson with the little bit of time that you have. Number 5, it's best if you have or obtained their clinical application goals to begin with. This kind of ties into what I was just saying. Like, it would be good if you knew that maybe if you had 4 parts of your lesson, and if you knew that part 3 is going to be more relevant for that doctor during that training session, then it may be best to start there, so they feel like they got the most out of it. So in case you were only able to train them on 2 out of 4 of your training content during that visit, they at least got the meat that they were looking for. I learned this the hard way. Trust me in this type of expectation. The 6th thing to expect is that you will have some short training days. Woohoo! Sometimes that's really good. Okay, now remember going back to the whole get in where you can fit in. Now sometimes you may have 7 docs, like I really did the other week, 7 docs that need training, and so you may be in one of the clinical rooms where you're just waiting and back and forth. They sit during their sessions, and however, sometimes you may have 2, and in all honesty, you can get 2 done if they're available in the morning time, and in the afternoon, it's all yours. The 7th thing you should expect is that cases can get canceled, and so therefore trainings can get canceled. And this is important because if you are training based off of a real patient or clinical scenario that is happening that day that you're there, then that training session with that case, that patient, is going to get canceled, okay? This is something that's really happened to me, and the truth of the matter is, to make the most of that time, because my company did pay for me to go there, I would use a demonstration case, right? I would use something maybe that they've previously done with another patient's information, and I would still train them, but it's nothing like real live active training. And I think that should have been an actual expectation, that you will be doing a lot of training based off of a live active patient cases. Expectation number 8 is that you will learn a whole lot clinically when it comes to just waiting around to train someone. And so you'll hear a lot of discussions. You'll actually see patient treatment sometimes, depending on if there's a separation room, like I said, or interventional radiology. I would actually watch these minimally invasive surgeries behind a glass window. So you'll hear and you'll see a lot. And that is, of course, just helpful for you. What PhD person doesn't want to know more? The 9th thing you should expect is that you'll see a lot. You'll see how things actually flow. You'll see how people operate, even in an operating room. But you'll see how things operate. You see how the department operates. You see how closely the nurses, the medical physicists, the radiation oncologists, interventional oncologists, whatever your types of docs are, how they really work together with each other, how they work for the cause and the good of the patient. You'll really see a lot of that. And so even someone in that role, they don't really get to see it because they're part of it. But you're now the observer. You're watching this. And you will learn a lot just from being able to be that observer. The 10th thing that you should expect is that you are the most knowledgeable person in that room in regards to the reason that you came there to train them, right? So that knowledge content that you're delivering, you are the most educated and knowledgeable person. Expect to be that person. Do not expect to be, I'm just a application scientist coming in. No, you are the expert. So have that expectation, because they expect you to be the expert. Because when they asking you questions with the little bit of time that they have to give you for training, you better be acting like you're the expert. Alrighty. So I hope these 10 expectations are going to be helpful for you, so you know what to expect. in the medical industry as a field application scientist. Listen, like I said, I learned the hard way. I hope this video will help you to be more prepared of what to expect. If this video was helpful to you, then make sure you give it a thumbs up. More importantly, I keep saying this, subscribe. Share this video too. I know sometimes it gets a little bit like questionable. Should I share this? Because I don't want somebody else to know as much as I know because we're both going for the fast roll. Listen, share it because you want to be able to help others just like you're being helped, right? If we each one help one, then we'll all be helped. This will be a field application scientist community. I believe that. It will be booming. It will grow. It will be so many of us. Even if it sounds like the title of the role changes, like mine has changed. I'm not called a field application scientist anymore, but a lot of what I do still stems from that role. So share it, guys. Subscribe. If this is something you want to see more of, if this is something that you feel like other people who are trying to get into the role want to see more of, then please make sure you subscribe and tell other people about it. Guys, I do thank you for tuning into my channel, and I hope to be able to connect with you again soon. Bye.